What exactly does niacinamide do for your skin? According to popular beliefs, it can strengthen the skin barrier, reduce aging and inflammation, regulate sebum production, reduce hyperpigmentation, and improve overall skin tone. However, these theoretical benefits are really only meaningful if they are supported by actual clinical human evidence. So let's set aside the theory, the marketing, the influencer hype, and focus on what human research says. What do clinical trials reveal about the realistic benefits of using niacinamide in skincare? Vitamin B3 comes in two main forms, niacinamide and niacin, each with different uses and chemical structures. Niacinamide, also called nicotinamide, is the form used in skincare products and has potential benefits for the skin when applied topically. On the other hand, niacin, or nicotinic acid, is rarely used topically because it can cause pretty intense skin flushing when used, which is harmless but highly unpleasant. Rather, it's taken as an oral supplement to reduce cholesterol and support heart health. As a result, niacinamide is much preferred over niacin because it doesn't cause the flushing that niacin can trigger. It's also studied more extensively for the skin than niacin is. In terms of dosing, niacinamide is typically dosed in concentrations anywhere from 2 to 5%. Higher concentrations than 5% are not necessarily more effective since niacinamide is already relatively well absorbed into the skin. With that in mind, let's talk about acne. Niacinamide is believed to help with inflammation and oil production, but does it actually reduce acne? Preliminary clinical research shows that applying niacinamide cream twice daily for 12 weeks in combination with benzoyl peroxide can reduce the number of acne lesions. Another study found that adding in a niacinamide cream while already using the anti-acne medications benzoyl peroxide and adaptogene gel showed a small additional reduction in acne lesions compared to placebo cream. One clinical study even shows that applying niacinamide gel twice daily for 8 weeks is as effective as an antibiotic gel in reducing the number and severity of acne lesions. Interestingly, niacinamide appeared to be more effective with patients with oily skin. In fact, it's likely that niacinamide's anti-acne effect is primarily due to a reduction in sebum or oil production. A small trial found that topical niacinamide modestly reduces sebum production. However, a preliminary clinical study involving patients using the anti-acne prescription medication isotretinoin for acne found that adding niacinamide cream twice daily for 6 months did not further reduce acne lesions, but did reduce redness, dryness, and itching from taking the medication. Oral niacinamide has also been studied, with some weak evidence of benefits. However, it has only been evaluated in combination with other ingredients, so its effects when used alone is unclear. For example, a combination branded supplement called Niacin that contained niacinamide among a bunch of other ingredients found some weak benefits. And another branded combination supplement called Niacin also found some weak benefits. So when it comes to niacinamide for acne, topical applications have much stronger evidence supporting their use than oral ones. Niacinamide also seems to be best for oily skin types and shows the most benefit when used alone. Research indicates that combining niacinamide with other anti-acne therapies, especially stronger treatments like benzoyl peroxide or prescription medications, may not provide much additional benefits. However, niacinamide may still help reduce side effects of such medication, such as redness or dryness caused by these stronger anti-acne treatments. What about wrinkles and aging skin? Can niacinamide help make your skin look more youthful? One study showed that applying niacinamide cream to one side of the face for 18 weeks reduced wrinkles. Another study involving women with photoaging found that applying niacinamide cream twice daily for 12 weeks improved not just the appearance of wrinkles, but also blotchiness and skin elasticity compared to a placebo. Now, I'm not sure I could definitively say that these are anti-aging effects, but the improvement of skin elasticity and other factors does suggest niacinamide may have deeper effects on the skin than just reducing wrinkles. These studies do provide some evidence that niacinamide can reduce the appearance of surface wrinkles, and may even benefit the skin at a deeper level. However, simply saying niacinamide is good for anti-aging might be an oversimplification. The strongest research points towards niacinamide's ability to help with reducing accelerated skin aging due to UV radiation, also known as photoaging, which we'll get into later in the video. However, there's far less clinical evidence to show that niacinamide alone is effective at reducing the slower natural aging of the skin. What about dark spots? Can niacinamide help with hyperpigmentation? A small clinical study in Japanese women found that applying niacinamide moisturizer twice daily reduced hyperpigmentation and increased skin lightness after 4 weeks compared to a placebo moisturizer. However, further improvements were not observed after an additional 4 weeks of treatment. Another small study in Korean women showed that using a moisturizer containing niacinamide and tranexamic acid twice daily for 8 weeks reduced skin pigmentation compared to a placebo. However, since this study combined niacinamide with tranexamic acid, it's hard to determine the exact effects of niacinamide alone. In women with melasma, a condition causing dark patches on the face, a 4% niacinamide cream was almost as effective as 4% hydroquinone in reducing pigmentation and had fewer side effects. So there is some weak evidence that niacinamide can reduce hyperpigmentation and dark spots, but these studies also used broad-spectrum sunscreen 2 to 3 times daily, and the overall benefits were small. This means even if niacinamide can slightly reduce hyperpigmentation, if you don't use sunscreen daily, and in some cases multiple times per day, to prevent further pigmentation, you likely won't notice much benefit from niacinamide. What about UV damage? Niacinamide is believed to protect the skin from DNA damage, but can it actually reduce sun damage? One clinical study found that patients with a history of skin neoplasms who took niacinamide orally twice daily for 12 months saw a reduction in the development of these neoplasms. A meta-analysis of several small clinical trials showed that using niacinamide daily, both orally and topically, for 1 month to 5 years lowered the risk of non-melanoma skin neoplasms, including basal and squamous cell neoplasms, by 50% compared to a control group. So it seems niacinamide can reduce damage from UV radiation by decreasing the development of non-melanoma skin neoplasms, especially for those at risk. For this use, oral niacinamide has the strongest evidence, but there is some, albeit weaker, evidence that topical niacinamide also offers protective effects. However, these effects are mostly preventative, and there's no evidence that niacinamide can help with skin neoplasms once they have already developed. Niacinamide has also been studied for various skin disorders involving inflammation. For eczema, a small clinical study found that patients who applied niacinamide cream twice daily for 8 weeks experienced decreased skin water loss and improved skin hydration compared to those just using petroleum jelly. For psoriasis, preliminary research in adults showed that applying niacinamide cream twice daily for 12 weeks improved psoriasis scores compared to baseline. However, the study does not have a placebo group, so take these results with a grain of salt. For seborrheic dermatitis, a small study on patients found that applying niacinamide cream once daily for 12 weeks reduced the severity and symptoms like redness and scaling compared to a placebo cream. So there is some evidence that niacinamide can help with certain inflammatory skin disorders, but the evidence is still very weak. Overall, topical niacinamide can be beneficial for various skin conditions. It is decent evidence for reducing acne lesions, especially in those with oily skin, and it may help reduce side effects like redness or dryness if you're using other stronger anti-acne treatments. Taking niacinamide orally might also lower your risk of non-melanoma skin neoplasms if you're at high risk. However, the evidence is much weaker for treating other inflammatory skin conditions like eczema or psoriasis. As for cosmetic issues like wrinkles or dark spots, the realistic benefits in these cases are likely small, and you probably won't notice much improvement unless you also consistently use sunscreen every day. Hi, I'm Dr. Brian Yeung. Have you used niacinamide for your skin, and what are your experiences? Let me know in the comments down below, and if you found this video helpful, please subscribe to the channel and leave me a like. Hit the notification bell if you want to stay up to date, and share this video with someone you know can use the info.